I'm Professor Gustavo Sudran, and I'll be chairing today's session of the King's Institute for Artificial Intelligence AI Plus Research Seminar. And I'll also be moderating the Q&A session after the talk. This afternoon, I'm delighted to introduce Dr. Georgia Richards. Dr. Richards is an epidemiologist, health research scientist, and King's Prize Research Fellow at King's College London. She founded and leads the Preventable Deaths Tracker, a national vigilance platform that collates and analyzes coroners' reports to learn lessons following inquests. She has a Doctor of Philosophy from the University of Oxford and a BSc in Biomedical Sciences with first-class honors in Pharmacology from the University of Queensland, Australia. Dr. Richards, please take it away.
Thank you, Gustavo, and good afternoon, everyone. Thanks for joining this webinar. So today I'm going to talk about a project that I started during my PhD, during my DPhil at the University of Oxford about 7 years ago, and has now become my primary research program. And I moved over to King's College London last year as a King's Prize Fellow to lead on this work. So today I'm going to talk about harnessing open data, which is really at the foundation of how I started and created what's called the Preventable Deaths Tracker. So over the next sort of 30-40 minutes, I'm going to talk about the development of the Preventable Deaths Tracker, the research that I've conducted using the data and the tools, and then the plans for next steps and the application of AI and automation. And then there'll be some time at the end for some Q&A. So feel free to use the Q&A box that comes up, and I'm happy to answer any questions. So to begin, I'm going to put this sort of deaths in context, so specifically for England and Wales. So if we think about all deaths that occur every year in England and Wales, this sits at around 500,000 every year for the two nations. We then have a particular system called the coronial system, which is a death investigation system. And this is led by legal professionals, so they're independent judicial officers, they're like judges, and they will get referred deaths when these deaths are deemed unnatural by, say, medical examiners or the police. So they get referred in these deaths. And for last year, this was just under 200,000, which represents about a third of all deaths. So we have about a third of all deaths that occur in England and Wales that get referred to these for these sort of death investigations that occur in the country. And then we have just under 37,000 of these deaths have an inquest open. So this is a formal legal proceedings in a coroner's court, in a court environment, where the coroner is tasked with determining who, when, how, and why, or who, when, and where these deaths occur. And they also have a legal obligation in England and Wales to conduct or to write and report what's called a prevention of future death report. So we have about 6% of all deaths that have this inquest open, which represents about 1 in every 5 of deaths that are referred to the coroner. And then we have this statutory requirement, this legal requirement to write a prevention of future death report, and which I'll refer to as a PFD for this seminar. So sorry about all the boring legal lingo, but this is really important to share about what the Preventable Deaths Tracker is. So once these reports get written by coroners, the coroner will then email these. They'll used to post them, but now they email them over to specific organizations that the coroners deem have the power to take action. Those organizations then must respond by law within 56 days to the coroner. And the coroner then sends the report and the responses via email to the Chief Coroner's Office, which is a national body in England and Wales. And the Chief Coroner's Office is then tasked with publishing these reports and these responses on a publicly available open website, on a government website. So my question sort of 7 years ago, or sort of early in my PhD, was trying to understand, well, we have this death investigation system that's been established in England and Wales, but how many deaths have been prevented? So are we actually saving lives and stopping these deaths from occurring in the future? So this was a sort of question I wanted to quantify. I wanted to know how many deaths and lives had been saved, but we were missing some really fundamental areas of data. The first was no one in the country knew how many were being written and why they were actually being written. So what types of deaths? Were they mostly written for children, infectious diseases, transport accidents, fires. There's so many different types of deaths, and we didn't know why they were being written or who they were being written for. And then we also didn't know how many organizations received these reports, what organizations received them, and whether they actually responded. So missing some really essential data and information in this sort of pipeline of death investigations. And so this information was publicly available, and it was during my PhD that I created a web scraper to start the sort of version 1 of what was then called the Preventable Deaths Tracker, and it's still called the Preventable Deaths Tracker, but we've come a long way since the first web scraper I wrote many, many years ago. So this was sort of the ethos behind sort of the data behind the Preventable Deaths Tracker. We're dealing with just these small prevention of future death reports. So now the Preventable Deaths Tracker is able to tell us this updates every single day. But if we're just looking at 2024 in context of this data I already have here, 679 reports were written and published in 2024, which represents less than 2% of all inquests and 0.1% of all deaths. So we're dealing with a very small select sample of deaths. And across the sort of 12 years that this system has existed in England and Wales, about an average of 460 reports are written every year. If we then look at organizations that receive these reports, when I first started tracking this data back in 2020, this sat at less than 1/3 of all organizations were responding to the coroner, despite this legal obligation to respond. With all of the data-driven work that I've been doing over the past sort of 5-6 years, we now have more than doubled that. And we now have over 60% or nearly 2/3 of all organizations who are responding to the coroner, which is a huge achievement in the coronial system that has never used data or evidence to inform and improve its practice. We now know that there's more than 2,000 people and organizations across the country, as well as internationally, that receive these reports. So what is the Preventable Deaths Tracker? It is an evidence-based vigilance and learning tool that automatically and routinely and systematically collects all of this publicly available open data and then turns that into usable information where we can conduct research and provide these real-time analytics. So this is sort of version 2 on the left. When I started at King's, this is what it did look like on the left. And King's has given me, through the King's Prize Fellowship, has given me dedicated time to work on this full time. So this was a sort of side hobby project for many years after my PhD. And it wasn't until I moved to King's where I've really been able to transform the Preventable Deaths Tracker into a real sort of tool that I'm able to work on a daily basis. So extremely grateful to King's for that. But there's just is sort of a contrast of what it used to look like and what it now looks like. And I'll talk through some of the tools that I've developed in the last year and a half. So there are 2 primary aspects to the tracker. The first is we have this automation around the web scraper that goes on and collects all of this information. We use a webhook to let us know when any files change on the judiciary, on the government website, so we can update this information in real time. But the first component is that we have a searchable repository. So more than 13,000 files are now digital. This is not the case on the government website. And this digitalizing these files allows us to run free text searches and really harness that information that isn't currently possible on the judiciary website. We then put that searchable repository on top of a relational database. This database has more than 12 years of data, and it allows us to then provide automatic updates and real-time statistics of the information that's within the database. So on the website, we have a sort of comparison about what the judiciary website does and what the tracker does, and explains it in a bit more detail, but I'll now walk through some of the key features of the tracker and the tools that we have available. So the first aspect is we're able to analyze the data based on the date of report. So this allows us to conduct and provide annual statistics. And so if we just look at 2024, for example, we can look at, as soon as we put in those dates, all of the different dashboards on the website automatically update, and you can see the different statistics for the different metrics. Just to say, going back to sort of data, the data report on the judiciary website, you can filter by date, but it's of date of publication. And so what we're finding over the years, a lot of old reports get come online a lot later, so there is a delay in publication. But by using date of report, we're really able to look at the trends of coroners actually writing those reports in a particular year, or it might not be a year. We might want to look at financial year or calendar or academic year or whatever the year is that we're interested in. So that's a really key component in terms of being able to select the different types of dates that we're interested. The next aspect is we're able to look at geographical variations across the country. So coroners are segregated into 75 or so coronial areas. These areas don't align to any other areas like policing areas or regional areas. They do align slightly to local authorities, but they're their own entity. So we're able to look at the number of reports by individual areas across the country. Since I've started tracking and since we've been looking at this data, Greater Manchester South and Inner North London have always been the areas that have been writing the most reports. We're then able to, in addition to looking at the areas as a bar graph, we're also able to utilize the mapping of those areas. So this is an example where we have, where I've selected all of the coroner areas that are specific for Wales. So able to then compare between England and Wales and download and analyze and use the information just for Wales or just for England, for example. So here's just a capture of the information based on Wales alone. We're then able to filter the information by the specific coroner. So this is a feature on the PDT that a lot of law firms use as they're preparing for an inquest. So they might be about to go and I just put John in as a basic name. I didn't want to pick a specific coroner, but they might want to search and read the report of a coroner they're about to go and defend their client against at an inquest. And so this is one that lots of inquest lawyers do use, or bereaved families also use this to try and look at what other reports have been written by the coroner that they're about to meet, who's about to do the inquest for their loved one. We then also can look at the number of reports by individual coroners. Looking at this just looks at the top 30 different the top 30 coroners who write the most reports. There's also hundreds of coroners that write no reports. And it's a very, despite having a legal obligation to write these reports, it is up to the discretion of the coroner. They are independent judicial officers, and so they can make an independent judgment as to whether they will write one of these reports or not. Then we can also, really importantly, before the tracker existed, no one in the country knew what organisations were actually receiving these reports, and the organisations themselves also didn't know how many reports they were receiving. So I've had many, many meetings over the last few years with the Department of Health, NHS England, the CQC, HSSIB, the Ministry of Justice, many of these organisations, and they couldn't actually tell me how many reports they were receiving. So the tracker now does this for them. Unfortunately, despite public organisations don't keep a routine tracking mechanism internally, this has started to change over the past few years. NHS England now has a regulation 28. They call it working group, and some NHS trusts also have mechanisms where they are starting to track it. But this has only started to occur in the last few years, despite these reports being written for more than 12 years. And so I've just highlighted the MOJ here to look at the stats. So these are the top 30 organisations who receive the most reports. And the Ministry of Justice is the leadership organisation who's responsible for the Coronials Office. Despite holding that leadership position, they unfortunately have the lowest response rate. So more than 2/3 of reports that they've been sent have gone unresponded, which is really disappointing from a governmental leadership position. And I do work closely with the MOJ to try and improve those statistics. In addition to looking at the top 30, you can also individually look for that organisation within the filtering capacity of the tracker as well. So able to search for the MOJ. Now, this has been, in order to get these sort of more than 2,000 addressees collated. I've had to do a lot of data cleaning over the years. So a lot of the first few years of the tracker was really developing algorithms to clean and standardize the data, because all of this information is manually added on to a government website. Sometimes it's scanned documents, it's photocopied documents, it's photographed documents. Things is improving over the past few years, but the old data has been a challenge. And so we've started to use a bit of machine learning and some tools to improve that, particularly around the addressees. So the Department of Health and Social Care, for example, was written in 45 different ways when I first started the tracker. And so we've had to build mechanisms to standardize that. And that's why the tracker is a really important tool in terms of looking at organization names rather than using the government website, because there is no standardization in how coroners report or write the different organizations' names. So it looks simple and nice and clean now, but it's been a journey of many years of writing lots of code and coming across lots of challenges along the way as we were trying to clean this information that comes from a government website. Moving on to trends over time. So I'm an epidemiologist. I'm really interested in population level trends and how we can sort of track different types of deaths over time, and how those deaths, we ultimately want to see these deaths reduce. But because we have such a small sample size, we're really left with sort of select sample of cases that we can work with. But the exciting thing that sort of happened over the past few years with this data that we're seeing is I was commissioned by the Judicial College in 2023 to provide some training to coroners about PFD reports. And this then has led to quite a big increase in the number of reports that are being published and written by coroners. And I do sometimes get emails from coroners letting me know that they've written their first PFD report, which is always nice to hear. And in addition to the number of reports increasing, we're also seeing the number of responses significantly increasing. So if we look at 2024, we're now sitting at, for just last year, we're sitting at 93% of all of these reports now have responses published online, which is a real huge improvement to back when I started the tracker, when there was less than a third of all responses published. So we've seen the average, or over looking at all reports, we've seen that, more than double. And for 2024, we're nearly at 100% of all organizations that are publishing and responding to the coroner, which is a huge achievement. And so we're hoping to see these trends continue in the future. This is the sort of dashboard that we've built to track the different color and what the different colors have meant throughout these different graphs I've been showing. But now we're able to track the different response rates to these reports. So the green and completed box is our positive box. This is where we've got nearly 2/3 of organizations who are responding. We unfortunately have a third of all organizations, sorry, not a third, a quarter of all organizations who have never responded, and we have no responses following these deaths, which is really disappointing. Then we have some organizations that will respond, some that won't on a single report. And so that's where our partial statistics come in. And then we have those that aren't yet, based on the legal obligations of the coroner, they're not yet within the duty to respond yet. So all organizations do have 56 days to respond. They can get extensions of that as well, which we don't account for in the PDT because we're not aware of those extensions. But that sort of gives us a flag around the new reports that are being published online that are soon to have a response due. Excuse me. So the other aspect that we've recently added onto the database, which we're really proud of and is exciting in terms of, although, we deal with death, which is not exciting, but it is exciting to have better metrics, which can help us improve and ultimately save lives. So in the past, we've been basing our statistics around the number of reports, which when it comes to an inquest is held usually for a specific event that has occurred. So unfortunately, if we have large events like fires or car accidents or terror attacks or sort of national disasters, we will see more than one death occurring in those reports and in those inquests. And so we now are able to provide different statistics where we have, sometimes we'll be referring to the number of reports, but we can now also refer to the number of deaths. And so that's really important in terms of understanding how we can prevent those deaths and understanding ultimately reducing those deaths in the future. So we're now able to look at these metrics based on these two different outcomes. I mentioned this earlier, we're also tracking the number of organizations, and we have more than 2,000 of those organizations who have received these reports across the country. One thing that we added last year onto the tracker is, unfortunately, there's lots of ethical issues around this, around putting a value, economic or a cost onto the loss of individuals' lives. But we made the executive decision last year to put this onto the tracker because of all the work that we're now doing with policymakers and ministers in government. And this is because unfortunately, the loss of life is not enough to lead to action. And a lot of our conversations with government has got to do around money. And so there is a value that the UK government, HM Treasury, use a statistic when they're deciding on new policies, whether they build a new bridge, a new hospital, a new school. And so it's called the value of a prevented fatality, or a VPF. And that value of a prevented fatality, based on 2023 statistics, was sitting at 2.6 million for every preventable death. And so we use that value of 2.6 million times by the number of deaths in our database, and we have that as a live tracking value across all of our dashboards. And this is a statistic that we use specifically with government ministers and trying to emphasize the economic costs of these loss of lives. I've mentioned this earlier, but this is our map that we have across all the coronial areas across England and Wales, and you can engage with that map to update the statistics across the Preventable Deaths Trackers tools. So what I've been working on more recently over the past 3 to 6 months with my team of RAs is we're working on new advanced filters which aren't yet live on the tracker. So stay tuned. We hope within the next 6 months we're going to be able to get these new advanced filters live. So in addition to data report, looking at the different addresses, areas, and specific coroners, we're going to launch some new filters where we're able to look at sex. So specifically looking at male versus female, sex splits, then also looking at age ranges. So from in utero, neonates, children, up until older individuals over the age of 95. So we've got deaths across the whole spectrum of ages in the Preventable Deaths Tracker. And then we've created a taxonomy. We have both report taxonomies and research taxonomies. And this is a lot of what we spend our days doing, going through the reports and validating. When we have sort of AI, we must validate AI mechanisms. And so creating this taxonomy has been a really important component of looking at the types of deaths that are being reported by coroners in these PFD reports. And finally, at the end, in England and Wales specifically, at the end of the inquest, a coroner has a requirement to make a conclusion of the case. And so we're able to now do some deep dives and filter the data by the individual coronial conclusions, which is a really exciting addition to the filters. We also then have got some more filters coming looking at addressees. So we're able to specifically look at different organizations by their categories. So instead of just typing in a name like the Ministry of Justice, we're able to type, for example, police services and look at all the police forces across the country, or all the ambulance services across the country, or all the NHS trusts by just looking at using one specific category. And then we're able to look at different organizations by the sector. So are they private sector, public sector, or charities and third sector organizations, and then whether those organizations have a local, national, or international impact. So those filters will be coming out in the coming months. Just quickly here, I've got a quick look at, this is not including all the data, it's just a subset of about 20% of the data, where we're showing you sort of the sex and age split across some of the data. But moving on to research. So these dashboards and these tools that we've created, we're able to then use for research, practice, policy, and surveillance, which includes the tracking of the responses, which I've shown earlier. So we've conducted more than 25 research articles, we've published and conducted more than 25 research articles. I'm not going to go through them because of time. I want to leave some time for questions, but we have had 2 new articles which sort of complement one another, looking at preventable deaths involving clots and preventable deaths involving bleeds that were reported by coroners in these prevention of future death reports. So they've just gone online. And we've also had a new study come out in the last week or so on looking at maternal deaths. So these are deaths in women that were either pregnant during childbirth or postpartum, and sort of looking at postnatal depression and other sort of complications following birth. And this recently got published, and how we had a lot of media interest following this publication. And I was talking on Women's Hour last week, so you can find that online as well. And so moving on, one new aspect of the tracker that we're really keen on developing is doing sort of rapid responses to government, not only government, but in this instance, this is the government call. So the Advisory Council on the Misuse of Drugs, the ACMD, was calling for evidence on harms relating to ketamine. So we were able to use the tracker tools to rapidly respond to the government and publish this dashboard and submit that to the government as evidence on areas that the coroners have identified around ketamine deaths. So this is something that we're expanding on. And if you're interested in looking at what dashboards we've made, they're available under the research tab on the tracker website. Another example of a recent dashboard that we built was in partnership with a charity. So we're also partnering with charities, and if there's anyone from different organizations interested in the data that we have, do get in touch and we can discuss developing these dashboards for your organization. But here we were interested in looking at fatal anaphylaxis, so deaths following both food allergies, drug allergies, and product allergies that have led to preventable deaths reported to coroners. So here is a dashboard that we built, and then we took this dashboard into Parliament, and we got working with our charity partner, the Natasha Allergy Research Foundation. We were able to bring together a group of 10 bereaved families, meet with the Minister for Victims, who's a part of the MOJ, and bring my team together to talk about the areas of interest and the sort of the recommendations that came out of this policy report based on this dashboard that we've built using the tracker. In addition to being a sort of academic in academia, we must write academic publications in order to maintain our jobs. But really what the trackers allowed us to do is to have impact beyond just writing academic publications. And by creating these dashboards, we're able to give the public and other organizations access to information that isn't behind an academic paywall. And so over the past sort of 6 years of running the tracker, it's had more than 200,000 users. So that's more than any academic publication would ever be read by. And I also run a newsletter which has more than 2,000 subscribers to that newsletter, and that means I'm able to create a community of interested individuals, whether they be bereaved families, law firms, public organizations, and coroners, to able to disseminate these dashboards and this information that we generate from the tools that we've created. So I'll just, I know time is almost up, but I'll just talk about two aspects where it's been used by government. So earlier this year, the government published the response to the Grenfell Tower inquiry, and they were able to reference and make use of the tracker in that response to the inquiry of the Grenfell Tower. Also, they invited me to give evidence at a Justice Select Committee inquiry into the coroner service, and they were specifically able to then use the recommendations that we've generated to write about this in the letter that was written at the conclusion of the inquiry into the coroner service. So this wouldn't have happened if I'd just been writing academic publications. It's purely because the government is able to have a tool that they can use to inform practice. But it isn't all so positive. There's a lot of sort of things that do need to be changed, and with very special thanks to a charity organization, I've been able to launch a campaign to improve the system, because the tracker at the moment is only focusing on prevention of future death reports, and it's unfortunately very, very behind, more than 25 years behind other countries like Australia, New Zealand, and Canada, who are able to analyze data from all inquests and all death investigations. So just because a PFD isn't written doesn't mean there isn't learning that has happened during that inquest. And so we are calling on the government to create a national statutory database of all preventable deaths, or all unnatural deaths to get referred to the coroner, and then to establish an independent research unit that is tasked with analysing that information and ultimately linking up all the data that exists across the death investigation. So we also have medical examiners, we also have other death reviews, and we have other safeguarding organizations that do investigations. But at the moment, it's impossible to bring together this information and analyze it for death prevention. So we're really calling on the government to take action to use this information to inform policy. And the final aspect I'll sort of touch on is an article that the Times asked me to write last year in January of this year. It's almost a year. And this then led to a philanthropist reaching out, who I'm very grateful for. Changing Ideas is a charity based up in Scotland, and they have been supporting me to run this campaign, as well as to make a whole new tracker for Scotland. So we're able to start linking up the data across the country. And so the Scottish tracker is built, but it's not yet live. We're working on that at the moment. And so I'm hoping in the next few months that we will get the second Preventable Deaths Tracker live, which will focus on data from Scotland. So to end, I want to talk about AI, and I know that is the purpose of this seminar. Fortunately, King's has launched a sort of new fellowship earlier this year, looking for AI plus fellows. So this is for the people working in the AI space, but may not have AI expertise, or maybe coming from a sort of different discipline and applying AI to other aspects. And so I'm delighted to have received one of the AI Plus fellowships. And so I'll be joining and starting that fellowship in January. And my plan for that fellowship is to create the world's first interdisciplinary AI medico-legal research lab to co-create a national safety surveillance system and enable evidence-based prevention. And the sort of overarching aim of that fellowship is to explore and test the ethical application of AI technologies for creating death surveillance and prevention tools, and understand the experience and impact of using such tools, so we can actually have measurable, we can actually measure that impact moving forward. Looking so beyond the fellowship and sort of in general what needs to happen across the country to make sure that we're learning from death, because we have no system at the moment to learn from death. The fellowship will aim to co-design AI tools to capture data from all inquests, not just these PFD reports that I've been talking about, then to establish a dedicated research prevention unit that actively uses this information to inform policy. And finally, going back to my roots, looking at sort of adverse drug reactions and pharmacovigilance, which is sort of where my background started, it'd be fantastic to go to start tracking beyond deaths. So I ended up in deaths because it's the most sort of adverse negative outcome that we have across the healthcare system. But there's so many different types of activities that occur that do lead to harm, that we do really need to improve the collection of data, the reporting of data, the analyzing of data. And I think AI will play a really important role in that. So ultimately, we want to go back to prevent deaths before they become a death. And finally, we've expanded into Scotland, but there's so much more data across the globe. And so I really do hope to see the Preventable Deaths Tracker go global. But to do that, we need to bring together sort of the fundamental aspects of bringing together AI informatics together with coronial law and the expertise of coroners, as well as epidemiology, public health, and then, of course, working with policymakers to bring about this change. So if you're interested in our work, you can subscribe to our newsletter. We send out sort of monthly updates, or we send out insights into new tools. And if you're interested from industry and you're interested in creating dashboards around different types of preventable deaths, do get in contact. And I'm happy to answer any questions. Thank you for your time.
Thank you, Georgia. Thank you so much. This was a fantastic talk. It's not only very interesting scientifically, but extremely impactful. So thank you again for sharing this with us. I have a few questions, but I'm going to go for the questions that are that have been posted first. So the first question here is the recent increase that we're seeing, was it in the reports, right? Was it partially reflecting the impact of COVID-19 pandemic on coronal processes in 2020? And also related to that, can the database present the data by year of death?
Yes, fantastic. So COVID. During COVID, unfortunately, a lot of deaths didn't actually go for coronial investigation because there was obviously such a big increase in deaths that were occurring. So I wouldn't be able to put a causal link between the increase we're seeing post-COVID and deaths during COVID, but we are definitely seeing more awareness and an increase in excess deaths, unfortunately, because of COVID. But this database itself, the numbers are so small and in essence so biased, and there's such a selective sample that we really can't put a causal link to COVID at the moment. But coroners is definitely getting more pressure from bereaved families to write these reports. So we don't have a clear answer, but yeah, COVID really, we saw less deaths being referred to coroners during the sort of crisis of COVID. And the second question, remind me, sorry.
Well, the second question is, can the database present the data by year of death?
Yes, so we do have that capacity. It's not public, it's not in the public interface. And we do have a lot more tools available behind in the back end of the database that my team use. So yes, we can look at year of death, and that's another sort of positive aspect about the tracker compared to the government judiciary website. We when we're publishing research articles, we use date of death as our sort of primary metric when we look at trends over time.
Great. And then we have a question about, so in your discussions with the coroners, do they give any indication of when they might choose not to submit a PFD response that received from an organization to the chief coroner's office for publication?
Great question. So this is number one question I want to. I've put a big fellowship application into UKRI. This is my number one question. I want to actually interview or ask coroners across the country systematically to get all the different responses. So there's been no research funding in the coronial system, so we have no evidence as to really what's going on. But in terms of why they won't submit a report, the most common, based on the many discussions I have with coroners, the most common reason to not submit a report is where, for example, NHS trusts will come to the inquest with a big, thick action plan that says to the coroner of all the brilliant, amazing things they've done and how this death will never occur again. So most coroners go, okay, great, in this NHS trust or hospital, I believe that this death won't occur again. But unfortunately, we do see those deaths occur again. And if we interpret the death, it depends on how a coroner interprets the legislation, because some coroners will go, okay, great, this NHS trust has made provisions to prevent this death, but nationally, say NHS England or Department of Health and NHS Wales, this death could be occurring in the hundreds of other hospitals around the country. And so then they should really write a report to a national organisation to try and prevent that death from occurring. But we really see really varied interpretations of the law, and we see varied reasons as to why they do and don't write these reports. So it's a really sort of biased system, which is why I'm calling for a national database of all inquests, so we have no bias around looking at deaths where a coroner decided today I'm going to write this and tomorrow I'm not. So there is some bias there.
Right, that makes sense. So the follow-up for that question is the chief coroner's expectation that coroners will share all PFD responses with their office for publication?
Yes, which as a sort of data-driven person, in 2025, unfortunately, the Chief Coroner's Office and coroners across the country are using an email-based system to share this information. So there is no national digital database that they use to sort of process and centralize this information. It is dependent on individual administrators or coroners themselves who are very busy in an office to write an email to the chief coroner attaching PDF documents. Now, we know that in 2025, there are many other tools out there. So if anyone is from the tech industry and wants to build a really nice, simple design that you could sell to the chief coroner's office, that would be brilliant, because that's really what they need. They need a tech solution to streamline the sharing of this data. So it's up to individual admin people to send PDF attachments to the chief coroner's office, which is really unfortunate. And lots of errors then occur. Attachments don't get done, emails don't get sent. And so it's a really biased, untechnological system at the moment.
Yeah, sounds like it, yeah. So are the actions described in responses to PFDs enforceable? And what happens if actions are not carried out?
Yes, unfortunately, no. I'm only able to look at from a sort of data perspective. I'm only able to look at whether an organization responded or not. We can't go beyond that. And so an organization could indeed respond and say, "Thank you so much for your letter, for your report. I'm not taking any action." And the coroner or the chief coroner cannot do anything about that. So there is a real gap in the system for ensuring organizations do act. But there are a lot of other countries like Australia, New Zealand, and Canada that have evidence-based ways of dealing with that. And they write recommendations and they work directly with organizations to co-design strategies to make change in the system. At the moment, although the inquest system is inquisitorial, so we're meant to investigate, it's an investigative system, it's not adversarial like the criminal court, for example, there is a real adversarial tone at the moment around organizations and coroners and bereaved families. And so a lot needs to be done to improve the system to ensure that actions are taken and that more sort of we're able to sort of follow up to see has this organization made changes since the death occurred, but there's no one responsible for analyzing or looking at that at all at the moment.
Got it. And there was a question about privacy. So how is data privacy protected in the system?
Yeah, this is a really good question and something I grapple with, having come from a healthcare background, working with electronic healthcare records and the importance of patient confidentiality. Unfortunately, when we die in the UK, our GDPR rules and the Data Protection Act no longer applies to deceased people. So it's something that us as citizens often aren't aware of and don't realize. But there is a lot of sort of power of the coroner so these reports, we can see their name, their age, all about sometimes about their personal backgrounds and personal circumstances. And fortunately for me, but that information is all published openly on a public website. So there is no GDPR rules that apply following the death of a person. So I do, although that's the case, I don't publish names on the Preventable Deaths Tracker. So you won't see people's names. It's all sort of, that's how we build dashboards. So you can look at trends over time and age groups and things like that, but we won't assign that to an individual's name. So coming from the healthcare background, I do try and apply how we work in healthcare, but there is no GDPR to protect the privacy of individuals following death.
Thank you. Then there's a question, will we be able to search the database for places where deaths occur, like bridges where ownership may vary?
Yes, so at the moment, no, but we do have that tool available in the back end of the tracker. And every couple of months, we start to sort of release new components that are publicly available. But if you're a student or a academic and you want to get funding, I should say that until I joined King's, all of this research is completely personally self-funded. So it's something that I had to fund. I also do still self-fund the infrastructure. So I fund the Amazon Web Services, TechStrack, machine learning components and things like that. So it's very difficult in academia to get money for infrastructure. It's very easy to get, or not very easy, it's much easier to get funding for sort of answering research questions, but building infrastructure, it's really challenging to get funding despite our move to AI and interest in that. So do get in touch if you're interested in an area like that. And we do have lots of tools available offline, but we do have to build, I have to wait till I get a pot of funding to then build tools that can go online. So it's a constant challenge of getting funding to build these certain tools and make them publicly available.
Yeah. And there's a question now about from someone that just subscribed to a mailing list, apparently, saying that is there an organization campaigning to make responsibles enforceable?
Yes, so there is an organization called Inquest. They are a charity that are based on state-related deaths. So those are deaths in prisons or mental health facilities or immigration detention and police custody. So they're a charity that's been around for a really long time, about 40 years, I believe. And they are campaigning to create a mechanism, a national oversight mechanism to ensure responses are acted upon. So they have the campaign on their website, which you can find online.
Great. I have a couple questions. So I was wondering, the data that you are accumulating and curating, right? Is that also is scrapable by like bigger entities, so like Google's and any other big the LLMs out there that search them online, right? So is that data scrapable by them? Can they use that data to answer their questions and learn?
Yeah, they definitely could. I don't know of any that are because unfortunately I've found this niche area of like death. It's not very, people don't really
Sure.
want to work in this area. There is no, despite all of our sort of healthcare clinical trials, for example, have death as like the primary outcome. There is no sort of research center or area that really focuses on death or death prevention. So I don't believe that Google or Microsoft or um, OpenAI have really scraped it and done much on it, but I would be delighted if they wanted to, and would be great to partner with them if they did, because the data is so messy and it's real world. It's what we call real world data. It's real people, and it's all written, so it's all verbal. It's not structured data, and what the tracker does is to make that structured. So there is no structure to that data. So fortunately not, but if they wanted to, it would be great to work together.
Yeah, and follow up on that, you're talking about the lack of structure. So it said that in the beginning, a lot of the work was manual, right? Trying to basically curating that. What kind of technology are you using now? So like OCR and things like that. So what's your current pipeline? How much has improved since those days?
Yeah, it's changed a lot. We're in the sort of third phase of the tracker, I would call it. Phase one was a really simple web scraper that just like got it into a structured database, and then sort of phase two was like the data cleaning component where we were then able to make sort of graphs and the data was clean enough to produce a graph, which was a big win back in the day. Now we've really changed. We've got actual software, so we've actually built software within WordPress, although WordPress won't be our forever home, but it's just because once we get more than 6,000, we're at 6,000 reports. So once we get hundreds of thousands, when we have a whole, we'll have to change our provider. But it works by, we use Amazon Web Service is our primary software, and through Amazon Web Service we use their LLM technology called TextTrack, which enables us, which is basically like a OS. It's basically, yeah, is able to analyze the, or is able to turn the words into text for us. So that's our sort of main software, and then we use a sort of relational database on top of that. Where at the moment we do have an automated. We're able to automate some of the pulling of data from that. So things like dates, names, coroner areas. We automate the pulling of that data, but I do have 3 research assistants who are working on some manual extraction as well. So it's currently not all automated or all machine readable in terms of some of the variables that we're interested in. So taxonomy at the moment, we're doing that manually, which is what we sort of want to move to a more automated approach. So hopefully next year when I start on the AI fellowship, there'll be more tools to come.
Yeah, that's great. And lots of your slides had like a comparison, right, of the judiciary and then what is in the tracker. Have been reached like has they tried to reach out to you and try to like like what you're doing is I don't know so much better for the lack of a better word, like trying to like support you in many different ways, even if it's just like providing things in an easier format, like.
Yeah, so I've been working with them for sort of 6 years. Like we talk via email sometimes. It's weekly because I'm saying, hey, you forgot to attach this file, or this file is missing, or you've uploaded the wrong file to, like, you've put the wrong addressee on this
Yeah.
file. So we do have a lot of contact, and data has improved over time. So a simple thing like they used to use instead of using colons and full stops. So I've been able to work with them to improve data quality, which has improved our data capture. But unfortunately, there is not much interest on data in the coronial office or in the coroner's office at the moment. They are, I think, with pressure from bereaved families and the media, starting to sort of become more interested in it. But yeah, I did like the training for them for about a year. So I met every coroner in the country, and I met recently, a couple of weeks ago, I met with the chief coroner. So I do have dialogue with them, but it would be great to have more dialogue, and even sort of, I would love if they would use the tracker as like their server and they could directly upload the files there. And it would, there's so many things that we could do in terms of software. I spent so many years building software that would really be able to streamline and improve how they're publishing data at their end. But I think we're a long way away for seeing that come into sort of standard practice within the chief coroner's office.
No, I understand. Yeah. And you mentioned charitable foundations, specifically funding the Scotland effort, right? So there's a question here about any organizations that are helped to fund this. So what other organizations could potentially help with this work?
Yeah, so it's really been charities, which there's been no private sector. It'd be great to have private sector involved. So I am in discussions with one software engineering company who might be able to do some pro bono work for us. Because the building and software development does have a big cost, and so any sort of pro bono work with sort of private companies around that. I've sort of been because I'm sitting at an academic institute. I haven't made the tracker for profit. But there could be a lot of organizations like law firms who want to use it to litigate, or use it for preparing for inquests and working with clients. So there is a commercial angle to it, but I haven't really gone down that track at the moment because it is a sort of, at the moment, I want to use it for academic purposes and work with sort of charities and non-for-profits. But we'll see how the funding environment changes in the UK over the next few years with the economy, and see what angle we have to take it, because software is really expensive and infrastructure is really expensive. But ultimately, this should be something that the government, the UK government, funds. And I didn't say it at the start, but I'm Australian. I moved to the UK 8 years ago, and Australia has had a national coronial database for 25 years. And so there are other countries that actually created their legal systems. They're from Commonwealth countries, so Australia, New Zealand, Canada, Commonwealth countries. They created their legal system from the UK, but they've obviously rapidly advanced their legal systems, particularly around coroners, in terms of creating it as like a public health prevention arm of their public health system. And so in Canada, they're using the coroner system to reduce opioid deaths as the opioid crisis in North America. And there's so many ways that the coronial system could be used for public benefit and for public health. But the UK has kept it very much so as a legal system and not interested in public health or interested in death prevention. So ultimately, it'd be great for the government to the MOJ and the Department of Health to work together and create a public health prevention system, and they should really be funding this. And I do think it should be kept independent, which is what the Australian system, it's kept as an independent organisation, and it collaborates directly with Monash University and universities who do the digging. So it's a really unbiased system. So I think, yeah, the government needs to take action. But until then, we will keep going and keep, building tools and trying to make sense of this information. So these deaths we have data around how we can prevent these deaths from occurring in the future.
Yeah, that sounds great. I'm not seeing any more questions. I don't have any others either. I think if there are no other questions, I'd like to thank you again, Dr. Richards. Again, fantastic work, very impactful, and thanks for sharing it with us. All right.
Thank you all for joining.
Thank you. Bye-bye.
Bye.